You never know. And Becky Currie is with us on the Trustmark VIP Gallo guest line. Good morning, Becky. How are you, ma'am? Representative
Good
Becky
morning,
Currie.
Paul. Thanks for having me.
You got it. Let me say this, because I know in the beautiful city of Brookhaven, this goes there from every single hometown that we have across the state, and we cover them all. But I will just say this, because I was listening to the commercials in our market when this was on, and I think the one of them said, if you are looking for a deal, you're going to find it now. And I thought, you are right. If you have the hope and optimism and everything else, whether it's a home, a car, an appliance, whatever it is, a tractor, it doesn't matter. You're talking about some of the best deals. People are cutting deals now, so it is a good time to act.
And if you're ready to buy, now is the time. It will not only help you, it will help our business.
Absolutely.
Stay open.
I think it is when we talk about a buyer's market, this is it. So just think about that. Sit down, talk with your better half, and discuss it. I have a story here. It says, as we look ahead to life returning to normal or something closer to it, many companies are looking at how they'll be able to move forward. Among them, Disney. The company officials are already discussing the best way to go about safety when theme parks reopen for business. Executive Director or Chairman Bob Iger spoke to Barron's and said one possibility is taking the temperature of park guests when they come through, when they're admitted. And I thought, this is something that is probably going to be commonplace as we enter maybe sporting events, large gatherings, workplaces, maybe places like Nissan or Toyota, or even going to school at the community colleges will go through a temperature monitor scan. And if somebody's showing a temperature, then, they go to a room, they get a test, and by then we hope the test is, almost instantaneous, or at least 5 or 10 minutes for COVID-19, and then they can get a treatment and be isolated immediately. Is that too far-fetched? Could that be done?
Well, it could be done, Paul, but, the problem, my first thoughts when you were saying this was, if you're running fever, you've had it for a long time anyway. And how many people have you already come in contact with? So that's one of the reasons we're doing the stay-at-home order, and it's working. Believe it or not, we know our numbers are going up, but just think if people were still out and about like they in normal life, as we were laughing, as it may never get back to normal, but hopefully it will. But the problem with waiting till you have a fever is you've had it for a while.
Yeah. You being a professional in the medical field as a nurse, and you look at this, and again, kudos to the doctors, the nurses, the first responders, because it has become a different world out there. It is a war zone.
It is a war zone, and I want to thank nurses and doctors and respiratory therapists and paramedics, and you name it. They're on the front line, as well as truck drivers and people working at your grocery store. But as a nurse right now, I can tell you something. Life has changed. It's scary to go to work. You're worried that you're going to bring home the virus to your family. And, there's just so many questions out there. And it's been scary because, you go to work and a lot of people are complaining to me they don't have the right equipment. They're doing the best they can. People at home making masks. Believe it or not, it has been a gift that we've been able to have those. So, things are tough out there, and they're going to be tough for the next few weeks and maybe months. We don't know. And, pray every day for your healthcare workers, because if that goes down, we're in big trouble.
When you were listening to the debate and over the weeks and weeks about the mask, as a nurse, what were your thoughts on that?
About what, Paul?
About the mask, whether we should wear one or not.
Oh, the mask. Well, let me tell you, the N95 mask, anybody in healthcare knows that's the best one to have.
Mm-hmm.
And look, nobody saw this coming, or people who should have. We didn't prepare as well as I don't think we'll ever be caught in this place again. We learned from Katrina. We're learning from this. I think from now on, we'll make sure that everybody always has equipment. And it's a live and learn situation. but now we know, and now we always got to make sure we are equipped. And, just to spend a lot of money in a regular life, everything was going fine, and to have, millions and millions of dollars worth of equipment just sitting there, I understand why people didn't want to stock up, but now we know you have to.
Well, as a nurse on a daily basis, you get input from your patients and from the hospital administration. But as a state representative, you get a lot of input in different areas here. What are people telling you as far as the testing? How long it takes, and all of that? There's been a lot of people not happy with it.
Well, it was really bad. When you take a test and then you don't know whether you have it for 8 days, that's a problem. But now testing is better. Now here we have one that is 24 hours you can get. And I will say that I understand in New York they have one where you can find out in, 15 minutes, which would be lovely to have, because you'd hate for somebody to walk out the door, and go home and wait for days to know whether you were sick or not, especially going home to your family. But you just had to assume you were positive. And so, I do home health, and we're seeing a lot of sick patients. We're seeing a lot of other patients because they don't want to go to the hospital, where a lot of people are with the virus. So it's all hands on deck, and it's a different world for medical people out there.
One of the things I heard, and I saw an article on this, the onset of this, one of the reasons you had a pretty good death rate that kicked off was a lot of people just, even if you told them it was COVID-19, they just assimilated the information, and I think they thought a lot about, it's just like the flu. I'll get over this. I'm big enough to do this. And they stayed sick for a long time. And the nature of this particular virus, it got the best of them. They waited too long to go to the doctor.
Well, that's right. One of the first signs of it is shortness of breath, which is, a sign for me. If you're short of breath, that's not good. And, so the trick has been, when do you go to the hospital, and when do you start the medicine? And we're getting better at it. And, hopefully people won't wait too long. But I think early treatment and early testing is the answers. I don't think we've tested enough, and I don't know if it's because we don't want to see how many people actually do have it. But for me, I think it's best to know. I think in the long run, you can get a better grip on things. Knowledge is power. And if you know you have it and you're doing okay at home, then for goodness sake, stay at home.
Do you have access to this? You think Dr. Dobbs has access to this, to the total number of people who occupy a bed in a hospital that's been diagnosed right now with this? I heard you ask
the speaker that, and I don't know. Now, I'm keeping up with my hospitals in my district, but I'm not. I do not have numbers across the state.
Yeah, but don't you think, because we looked at the death toll or the amount of new cases as an indicator whether we're peaked or not, and I would think that the amount of people who have recovered, left the hospital, and no new admissions or lesser number of admissions would be another number that the people in the state would like to have.
Well, for me, it'd be encouraging to know how many people are well now. We kind of always tend to lean towards how many people are on a ventilator, how many people have passed away. Well, let's find out how many people actually had it and got better. That might be encouraging, except you may have more people wanting to get out of their house if they find that out.
That's the other side of the equation. I agree with you 100%. That's a little scary thing, because when we go on the downside of this, some people get out and start walking around. They've got it. Here we go again, and we don't need that. It's always
right. And when is going to be the time to go back to normal? Personally, we haven't reached a peak to know when to even consider that. So,
That's
right
true.
now, all of that is off the table, and I hope, just because we do not want to strain our healthcare workers.
Do me a favor, hang on for a second, because I want to ask you something about chloroquine, if we can, just to ease my curiosity when we come back. See. State Representative Becky Currie from District 92 is with us, and I want to ask you about chloroquine. Is the hospital there using it?
It is, and a lot of doctors are prepared and ready to use it. Mm-hmm. I feel, especially our rheumatologists, they prescribe this medicine all the time to lupus patients with rheumatoid arthritis, and they're not scared of it at all. When you're in a pandemic, you have to realize what it takes to get to a pandemic. It's time to use whatever tools you have to make sure that we save as many lives as possible. And this medicine, all the reports show that it works. So, I'm not uncomfortable at all having this medicine and using it. Like I said, you take it twice a day for 5 days, and your outcome is better. Why not use it? Every drug has side effects. If you look at the side effect of an aspirin, you may never take it.
That's true. That's absolutely true. But here's where, as a layman, I'm confused, and I think a lot of people who listen to this program are in the same boat, because this drug has been on the market now for over 60 years for lupus, for rheumatoid arthritis, for malaria. So we know what the side effects are. We understand all of that. And why the hell do we need clinical trials on a elongated period of time? We had a couple of governors who actually banned this thing, I think mostly for political reasons. As a matter of fact, story this morning is the governor who banned hydroxychloroquine, Nevada. He banned it, told the doctors and nurses there they could not use it. And then we find out this morning that he commanded the prison system hoard their entire supply. So the prisoners got it, but the other people in the state did not, and they're not happy in Nevada. But my question is, as a nurse, if we've gone through these clinical trials, we understand it's been on the market for 60-something years, number one. Number two, the side effects, from my understanding, are something like 0.7. So why do we need clinical trials?
We don't need. It's just foolish. How we even found out that this was something that worked was there was a group of people that had lupus and rheumatoid arthritis, and the scientists realized they weren't getting the disease. And so, here we go. Here is something that works, and it's easily accessible. Israel is sending us 10 million doses. That governor really should be arrested, in my personal opinion. You don't withhold life-saving medicine, ever. And, I don't understand. I'm sure there's somebody that will get on here and argue with me, but if I'm on a ventilator and I'm going to die, please give me the drug.
Yeah, I'm not worried about a 0.007 side effects. The side effect of death would kind of overrule that one. That was Governor Steve Sisolak, a Democrat in the state of Nevada. Well, we saw that also in, Minnesota, and a lot of it was political, simply because the president said he was open to moving that, putting it on the fast track. Is it being used as a preventative just to protect our nurses and doctors? Why aren't you people on it as far as in the hospitals?
Well, what you don't want to do is take it prior. I understand the point that those people didn't get sick, but what you do want to do is if you are a positive, then you have to see your doctor and make that decision. Do I want to go ahead and start it? Personally, I've already had that conversation with my physician, and we both decided if I were to be positive, that I'm going to immediately start taking it. So,
but not until.
But not until.
Yeah.
That's right.
Any other suggestions as a state lawmaker where we could improve this, as far as and one of the other stories out there nobody's paying attention? We had no idea several months ago this was going to come up. Our biggest problem worrying about the Mississippi Department of Health was how in the heck were they going to be able to handle if this referendum or initiative was successful in November as far as medical marijuana. how in the world were they going to handle this? Now it just seems to be that's secondary to this.
It's just not even on the radar.
I know. But
it's just really not. And, let me just say, Dr. Dobbs, the governor, they've all done a really good job, and kudos to them. We're in uncharted waters, and, thank you to the people of Mississippi who are following the stay-at-home order. It's working. We've got to continue it, and unfortunately, I'm sure that there's a lot of people that will get hurt financially, and hopefully we'll be there to help them every step of the way. We've got to get through this to save lives.
And the only way we're going to do it was with every single individual, and that's so very, very important. Becky, thank you for taking the time. I appreciate it so very much.
Y'all have a good day.
Thank you, and stay safe.